How do Medicare Advantage out-of-network costs affect me? Imagine needing urgent care while traveling or living from your regular doctors. Do you know how your Medicare Advantage plan handles costs if you see a provider outside your network? Let's find out. Medicare Advantage plans, also called Part C, are private insurance plans that cover your Medicare benefits. These plans usually work with a network of doctors, hospitals, and clinics. When you stay within this network, your costs are lower and your coverage is more comprehensive. But if you go outside the network, things change. Most Medicare Advantage plans are either health maintenance organizations or preferred provider organizations. Health maintenance organizations generally only cover care from in-network providers. If you see an out-of-network doctor with an HMO, you might have to pay the full bill yourself, unless it's an emergency. Preferred provider organizations are a bit more flexible. They do offer some coverage for out-of-network care, but you will pay more out of pocket. You might have higher co-pays or co-insurance, and your deductible could be higher too. Emergency services are a special case. Federal rules requiring all Medicare Advantage plans to cover emergency care at in-network rates, even if you're treated by an out-of-network provider. This rule helps make sure you're protected when you need urgent help. When you see an out-of-network provider, you could be billed for the entire amount the provider charges. This is called balance billing. For example, if your plan covers up to $10,000 for a surgery with an in-network doctor, but the out-of-network doctor charges $15,000, you might owe the $5,000 difference. With in-network providers, they can't bill you for this extra amount. Coverage for out-of-network services is usually less generous. Your plan might only pay a small percentage of the cost or might not cover those services at all. That means your out-of-pocket costs can add up quickly for non-emergency care. Medicare Advantage plans have a yearly out-of-pocket maximum. For 2025, the maximum is $9,350 for in-network services. If your plan covers both in and out-of-network care, the maximum can be up to $14,000. But if your plan is an HMO that doesn't cover out-of-network care, there might be no limit for those services. Before choosing a plan, it's smart to check if your preferred doctors and hospitals are in the network. If you often need care outside the network, a preferred provider organization might give you more flexibility, but expect to pay more. Always review the plan's benefits and costs carefully. If you do need care from an out-of-network provider, ask about the costs upfront. You might have to pay the full amount at the time of service and then submit a claim to your plan for possible reimbursement. Remember, understanding your plan's rules can help you avoid surprises and manage your healthcare costs better.